right, so in this video, I'm going to be practicing how to insert a Foley catheter into a male patient. So you're gonna walk in, gel in. I don't have gloves on at this point, so just ignore that. It was just convenient. I'm going to go introduce myself to the patient. Hi, Mrs. Gray. I'm Peyton James, I'm your student nurse. I'm going to be practicing, I'm going to be doing a Foley catheter insertion. Is that okay?
Mm-hmm.
All right, awesome. So you want to make sure you drape the patient, client for privacy. There you go. You want to make sure there's good lighting. And then this is when you would apply regular gloves. Make sure not to rip them, okay? All right, so now you want to lidocaine. I don't know where I put it, I'm sorry. You're gonna put lidocaine on the urethra and around the shaft. So I'm going to.
All right, here, I'll get it into position.
Okay, so you're going to insert it into the urethra and around. And then you're going to rub it in. Sorry, my bad. And then you're going to remove the gloves at this point. Throw them in the trash. And you're going to open the kit. Sterile, so keep that in mind. And then you're going to apply a waterproof pad underneath the patient. Also, you want to make sure that your patient is in the supine position because it's a male. So head down, knees up, flexed. There you go. And then so you want to put this is sterile, underneath the patient. Don't try to touch the wall because you don't want to unsterile it. Okay. And then also at this point you can put this around the penis for protection if anything comes out, like fluids or anything like that. Okay, so at this point now, I'm going to be putting on sterile gloves. I don't know, can you see it over here? I'm not looking in. You're gonna open it up. You're gonna start with your dominant hand first. Gloves on. Okay, and then you want to touch the fold of the glove. You don't want to touch the actual glove to help you put on, because if you touch it, it's going to be contaminated and it's not sterile anymore. Okay, there you go. So you're going to push that off to the side, and then you want to open everything up. This is your sterile pad. You want to open the specimen bottle so it's lightly closed. You want to open up the lubricant, and then you want to open up the iodine swabs to clean. Okay, so we're going to open these up. Not really sure how to open these. Okay, they're everywhere. All right. It's a mess. Sorry. All right, so at this point, you're going to swab this around. Oh, these are so messy.
I'd use a regular Q-tip. She has her scrubs on.
Okay. So I'm just gonna use regular Q-tips so they don't ruin her outfit. My bad. All right, so you're gonna start from the tip of the urethra, and then you're gonna go down and clean. You're gonna make sure you're gonna use 3 swabs. You're gonna throw each in the trash. Okay, and then you're gonna dispose of the swabs, and then you're going to make sure that the balloon inflates. Okay, we're just gonna try that now. Okay, so with your your less dominant hand, you're gonna hold it. And your most dominant, you're gonna push in to see if it works. And it does work. Okay, so you're gonna keep this attached. And then this is when you're gonna lubricate the tip of the catheter. So you would lubricate it. And you would go over to the patient. And then at this point, you're gonna grab from the tip 2 to 3 inches down, like right there. And you're gonna ask the patient to take a deep breath slowly. And then as they're exhaling, yes, you're gonna be inserting the catheter. Okay, and after you insert from that 3 inches, you wanna insert it 2 more inches, right there. And then at this point, you're gonna insert the 2 inches after the urine flows into the tube right there. Okay? And with the right hand, you're going to inflate to make the balloon. And at this point, I inflated it, but if I inflate too much, the thing's gonna blow up. And then gently pull on the catheter to make sure that it's in a good position so it can't pull out. And then you're gonna secure the tube on the thigh or the abdomen. Gonna clamp it. And you also wanna make sure to clamp the bag underneath the bladder. And so after that, you're going to throw away all your trash. Imagine I'm throwing this away. And then you're gonna remove this. And then you're gonna remove your sterile gloves. And that is how you do a Foley catheter insertion.